Good afternoon or good morning, whatever day, or good evening if it's the evening time that you're watching this video. It happens to be the morning time that I'm making this lecture video over Chapter 12, Severe and Multiple Disabilities. I hope that this information helps you to better understand the content material within the chapter. The learning objectives that this chapter covered have to deal with describing how the lives of people with severe and multiple disabilities have changed since the advent of the organization IDEA. This chapter also explains the various definitions and classifications of severe and multiple disabilities. It describes the characteristics and prevalence of children and youth who have severe and multiple disabilities. There is a list of causes and risk factors that are associated with the severe and multiple disabilities, and we will take a look at those causes and factors or risk factors within this lecture video as you read about them in the chapter. This chapter also discusses the assessment procedures that are used to identify severe and multiple disabilities in youth and children. It also describes the different interventions for children and youth with severe multiple disabilities. Let's delve now into the content material. Disabilities that involve significant physical, sensory, intellectual, and or social interpersonal performance deficits are known as severe and multiple disabilities. So you can see it covers a wide range of disabilities. And students, children, youth, young adults can have one or they can have multiple disabilities. Throughout history, the terminology associated with the severe disabilities has communicated a sense of hopelessness and despair. Way back in our history, persons with severe disabilities, with just one disability, or especially if they have multiple disabilities, they were considered extremely debilitating. They were considered to be extremely crippled. They were not considered to be relevant citizens of society. Many families locked their children in the homes, locked them in the basement, in the bedrooms. Some placed them in institutions and basically never saw their children again. Way back in our history, a family was embarrassed, considered degraded by society if they had a child such as this. So many of the families, that's why they would lock them in the homes, in the basements, or put them away in institutions, because they were ridiculed and considered a taboo family if they had someone in their family that had these kinds of debilitating disabilities. We have come a long way, and I know you've seen it, you've read about it, you've seen it in the old movies, you've read about it, about having those family members being chained in the basement and that sort of thing, being placed in the insane asylums. We have come a long way, thank goodness. We now have an understanding of the relevance of a person being a real life person. And we have an understanding of how to work with these students and these people that have these disabilities. In the 1970s, the APT Associates, described individuals with severe disabilities as being unable to attend even the most pronounced social stimuli, including failure to respond to invitations from peers or adults, and also as having a loss of contact with reality. And then that definition went on to be used as self mutilation. This is because some of these people with these disabilities would do the head banging, the body scratching, and the hair pulling. This appeared to be a ritualistic behavior, rocking and pacing. The self stimulation that they were inflicting upon themselves. The apt definition focused almost exclusively on the individual's deficits and their negative behavioral characteristics. Even as early as the 70s, we didn't really fully understand the complexity of their disabilities and the ways in which we can help these people overcome these disabilities, or maybe not overcome these disabilities, but to be able to work with their disabilities and enable them to find ways to move forward in the midst of having these disabilities. In 1976, Justin proposed the definition of those who are functioning at a general development level that is half or less than the level according to what would be expected on the chronological age. The definition states, and this is found in your textbook on page 294, a child should be assigned to a program for the severely multiple disabled according to whether the primary service needs of the child are basic or academic. If the diagnosis and assessment process determines that a child with multiple disabilities needs academic instruction, the child should not be referred to the severely disabled program. If the child's service need is basic skill development, that the referral to the severely multiple disabled program is appropriate. And then Tash Organization, in agreement with Snell in 1991, then proposed a definition focused on inclusion in natural settings. The natural settings involves the family, the community, and the school. And this definition was then readdressed and restated in 2014 and published in 2014. And we see this definition. People with significant disabilities and support needs who are most at risk for being excluded from society, perceived perceived by traditional service systems as most challenging, most likely to have their rights abridged, most likely to be at risk for living, working, playing, and learning in segregated environments, least likely to have the tools and opportunities necessary to advocate on their behalf, and are most likely to need ongoing individualized supports to participate in inclusive communities and enjoy a quality of life similar to that available to all people. I like the way that they pointed out that they should be able to support these people so that they can participate in inclusive communities and enjoy a quality of life that all people enjoy. So now we're recognizing finally that people with severe and multiple disabilities have the right to enjoy a quality of life like everyone else does. I'm so glad that we have finally come to this realization. The idea definitions of multiple disabilities are going to be discussed, but before I do that, let me point this out. The concomitant impairments. Now, a concomitant impairment means that a person is going to have dual impairments, dual disabilities, more than one disability going on at the same time. And these disabilities include the intellectual and blindness, intellectual and orthopedic, and so on and so forth. It could be visual and hearing loss, so on and so forth. Okay, so the combination of which causes such severe educational needs that they cannot be accommodated in special education programs safely for one of the impairments. The term does not include deaf and blindness. So, deaf and blindness is going to be dealt with differently and looked at differently. So, let's look at the dual diagnosis. Identification of both serious emotional problems and intellectual disabilities in the same individual. So, they have intellectual disabilities and they're also dealing with um, emotional problems. That's considered a dual diagnosis. Now, a dual sensory impairment is a condition that's characterized by both the vision and the hearing sensory impairments, the blind deafness or the deaf blindness, which can result in severe communication problems. Okay, they can't hear and they can't see. Yes, that is definitely going to result in having severe communication problems. That doesn't mean that they cannot be communicated with. You just have to learn how to find ways to communicate with these individuals. Deaf blindness is a disorder that involves the simultaneous vision and hearing impairments. The idea definition of deaf blindness is the concomitant hearing and visual impairments. It is the combination of which causes such severe communication and other developmental and educational needs that they cannot be accommodated in special ed programs solely for children with deafness or children with blindness. In our textbook, the characteristics of individuals with severe and multiple disabilities is further discussed. We see that the adaptive skills, the conceptual, social, and practical skills that facilitate an individual's ability to function in community, family, and school settings is very important. As classroom teachers, we have to be able to incorporate these adaptive skills so that we can work with these students in a social and practical as well as a conceptual uh, format. We need to be able to facilitate the individual's abilities to enable them to function not only in the classroom setting, but also within their families and their communities. Epilepsy is a condition that produces brief disturbances in the brain function, resulting in seizures of varying intensity. Epilepsy occurrences are usually detected early, but not always. So you can have a child in your classroom that that is on their IEP, that is on their 504, that's in their health records that they do suffer from epilepsy, and here are the accommodations when here are the symptoms to look for. So if you see this occurring, you know this is happening with this particular student. I have known of classroom teachers that their student begins to implement these symptoms and it's not on their file because they had not ever had this before. It has just now surfaced, and all of a sudden they're having these symptoms, and the teacher doesn't know that this student has this. The parents did not know this student had this. Then all of a sudden it appears, and what does the teacher do? So I encourage you to study epilepsy, be up to date on the symptoms so that when you see a student in your classroom implementing these symptoms, you know immediately what to do and how to handle. And remember, these seizures can be of varying intensity. They can be very mild, and the student can just kind of blank out and just kind of lay back for a bit, or the student can begin having those convulsions that you've heard about. So, just be aware of this and know. Now, every time a student blanks out, sometimes I blank out, and it's just because I'm having another thought, and all of a sudden I'm like finding myself thinking elsewhere. And this does not mean that just because they're blanking out, oh my goodness, we need to test them for epilepsy. No, that's not what I'm saying here, but I am saying if you see repeated and multiple symptoms, then I would begin to question and talk to the parents. Um, Athetesis or ptosis is a condition that's characterized by constant contorted twisting motions in the wrist and fingers. The spasticity is a condition that involves involuntary contractions of various muscle groups. And again, these can come on just out of nowhere. They can be right in the middle of a lesson, and then all of a sudden they have a spasticity moment. Just know how to deal with these. Get in and delve into these so that in case, especially if you know a child in your classroom has this, you'll want to do some in-depth research. Um, you need to be prepared and you need to be up on all of these things, but especially if it's been brought to your attention that this year this student has this condition, then you want to be well equipped in the knowledge of the symptoms and the experiences that student may implement within your classroom setting. Instructions for these students should be devised with outcomes in mind rather than on the basis of the characteristics associated with the label severely disabled. So don't think of this child. This is a severely disabled child, so I'm just going to do the best I can. I want you to think about this child in that, okay, this is where this child is. What can I do this school year? And I'm going to set some outcomes and some goals for accomplishing these outcomes with this child. I want this child to move from point A to B to C by the end of this school year. So set your goals and objectives to work toward those outcomes. You want to move that child along successfully. So keep in mind, you're working with this child to help this child make some academic progress, some social progress, some, it may be even some physical progress while he's in your classroom. So keep the child and the outcome progresses in mind as you teach and guide this child. Physical and health. People with multiple disabilities typically have significant physical and health care needs. For instance, these individuals have a higher incidence of congenital heart disease, epilepsy, respiratory problems, diabetes, and metabolic disorders. They also exhibit poor muscle tone, especially those students who are in wheelchairs. They often have conditions such as spasticity, ptosis, hypnosia. Such conditions require that professionals in the school and other service agencies know how to administer the medications. Some of these students may have catheterization. They may even have gastronomy, tube feeding. They may even be on respiratory ventilation. They may have the oxygen tank that they have to transport from class to class. I have worked in school systems where I have seen students with their oxygen tanks being on a little cart, and they're in a wheelchair and they're wearing their oxygen, and the person, the parapro, is pushing them around with their oxygen tank from class to class, um, or just pushing them around in the building from one location to another. So this is very common. So be aware of that. You will also may encounter students with vision and hearing impairments. Um, the prevalence of vision and hearing loss is not well documented among people with severe disabilities. The sensory impairments do occur more frequently in people who have severe disabilities than in the general population, but keep in mind that it does occur and you do have those students in your classes. Some individuals, particularly those described as deaf blind, have significant vision and hearing disorders that require services and supports that go beyond those for a person with blindness or just deafness. Okay, so they have typically a blind person, their hearing is extremely uh, well developed. They hear better than the rest of us. And a person who is deaf has typically very good vision. But a person with blindness, they know to listen intensely. They have trained themselves. I can hear, and I can hear things, and I learn more through my hearing. Just like the person who is deaf focuses on his sight because he reads the hand motions, he reads people's lips. My mother suffered from scarlet fever when she was a very young child, about 8 years old, and the scarlet fever back in her day hit, hit and killed a majority of the people. And it sprang out as a pandemic in her day, and she developed it. Thankfully, it did not kill my mother, but she did suffer hearing loss in one of her ears. And she learned at a very early age to read people's lips. So today, she still does that. Now, she has a hearing aid, a very high, intense hearing aid, very, very great quality hearing aid. So she hears extremely well. She hears better. I think she hears better than I do now, and I have great hearing, but she still has that ability to read people's lips. So she can tell you what someone across the room is saying by reading their lips. So persons who are blind learn to rely on their hearing. Persons who are deaf learn to rely on their sight to, take the place of and help them advance in their learning capabilities and understanding. But a person who is deaf and blind, they do not have, that backup to rely on. So they have to be dealt with completely differently. There are causes and risk factors that are associated with multiple disabilities. The genetic or metabolic disorders, the poor maternal health during pregnancy can cause the multiple disorders. The infectious diseases, as I said with my mother, she had an infectious disease, scarlet fever. She developed that as a young child. Venereal diseases can also lead to multiple disabilities. Most causes, however, for multiple disabilities do have a genetic in origin cause. Drug abuse can also cause multiple disabilities. If one or both parents, especially if both parents, are drug users at conception, the mother continues during pregnancy, there can be extremely severe multiple disabilities going on with that child. Chromosomal disorders, radiation exposure causes multiple disabilities. That's why when you go into the dentist and they're going to do x-rays in your mouth, they always ask, you have to fill out that questionnaire. Are you pregnant? Are you currently pregnant? If you are, they cannot do those x-rays. Advanced maternal age, mothers who become pregnant later in life, they have that fear and they run that risk of their child being born with multiple disabilities. Here are some of the risk factors involved with persons who have multiple disabilities. They end up having to have respiratory ventilation. Respiratory ventilation, you've heard a great deal about that most recently, but it is the use of the mechanical aid ventilator to supply the oxygen because the person, the individual, cannot breathe on their own without this breathing machine, this respiratory machine. Hypnosia. This is the poor muscle tone, um, debilitating their muscle movements and use of their limbs, even. Gastrostomy, tube feeding. This is the process of the person has to be fed through a rubber tube that is inserted in their stomach. Now, I have another example of this most recently with my mother. She had a problem with her colon, and she resulted in having to have a sigmoidectomy, which means they removed the lower portion, the sigmoid portion of her colon. And then while she was in the hospital, she was in the hospital for over a month. This was supposed to be a 5 to 7 day hospital stay after this procedure. She developed some complications. She is in her late 70s. She developed some complications in the hospital. Now, typically, my mother is a very active person, very healthy person, but she did develop some complications, and her age factored into this. And she was, her stomach was rejecting food after her sigmoidectomy, and they had to insert the feeding tube. And that was a very, very painful procedure. It was a surgical procedure, and they had to take her down to the surgical unit. And this was about an hour and a half procedure, including the recovery time, to just to insert this feeding tube within her. And so she, for about 2 weeks, she was in, still in the hospital. She was being fed through this feeding tube because she could not tolerate food in her system. This is not a fun experience for people to have to endure the feeding tube. Some people, this is just their way of life for the remainder of their life. Luckily, mother only had to endure this for a couple of weeks, and then they were able to remove it and reintroduce liquids, and then bland foods, and then now she is able to eat once again. But I know this from personal experience. This is a very excruciating thing to have to endure. But think about this. There are students that this is their way of life. Catheterization. This is the process of inserting that hollow tube, the catheter, into the body cavities to drain the fluid. And this is to, of course, drain their bladder, the urine from their bladder. I've seen students, mother had to have that also when she was in the hospital, but luckily we were only having to use that for about a week. But many students, unfortunately, many persons, many individuals, they have to have the catheterization for their entire life. And so you may have students going through the building in their wheelchairs with their bag, with their draining tube, their catheterization inserted, and their catheter bag hanging on the side of their wheelchair. So just be prepared for that. Now, most of these students are going to be in a self-contained unit, but not always. They may mainstream them into the regular classroom, giving them inclusive education experiences. Interventions for children and youth with multiple disabilities. We have to incorporate authentic assessment. These are assessments that focus on valued skills to promote independence and quality of life in natural settings. An alternative basis is also used to measure the student progress. This is assessment that is based on the student's progress in meaningful learning activities. The definition of that is regardless of one's perspective on the wisdom and implications of this accountability movement, it promises to have a significant effect on curricular guidance and FOSI for students with severe disabilities. A major question facing educators and parents is how can those concerned with education of students with significant disabilities ensure that a continued and focused emphasis on full membership and meaningful outcomes during this era. And that means that we're not just getting them by and moving them through the system, but we are focusing on meaningful outcomes for their academic, their social, and their preparedness for society. Alternate assessments are mandated in IDEA for students who are unable to participate in the required state or district-wide measurements. It ensures that all students, regardless of the severity of their disabilities, are included in the state's accountability system. And this is where I remember when I was a classroom teacher, I was always the one selected to read the tests aloud to the students who had difficulties reading and had these educational accommodations in their 504 and their IEP plans. I would read the test to them. They always picked on me because I was the English teacher, and they decided that English teachers are going to have those eloquent and gifted reading skills. I don't know that that's true with me, but that's what I was always assigned to do, was to administer the reading portions of the test for the students who had difficulties. These are some of the tips for classroom teachers to keep in mind. There have been careful stakeholder and policymaker developments and a definition of desired student outcomes for the population, reflecting the best understanding of research and practice. Assessment methods have been carefully developed, tested, and refined. Professionally accepted standards are used to score the evidence. There must be adequate training. There must be dual scoring. There must be third-party tiebreakers when grading and assessing the tests that have been administered. The reliability of the test is important, and rechecks or the scorer's competence when scoring these tests. So when these students are given these assessments, their assessments are scrutinized and their assessors are even scrutinized. An accepted standards setting process has been used so that results can be included in the reporting accountability. Yes, in every school district, those students who have IEPs, 504s, those students who are in self-contained classrooms, those resource students, their test scores are incorporated into the overall scoring testing data for the whole district, and broken down into the segments of the categories, the age groups, the grade levels, and so forth. So their test scores count. Okay. The assessment process is continually reviewed and continually improved upon. Services and supports for preschool age children. We know that there are preschool programs for children who have severe and multiple disabilities. They do continue to focus on family involvement while they are extending the life space of this child or of a child with severe disabilities to the school setting. McDonald, Hardman, and McDonald in 2003 came up with 4 goals for preschool programs who are servicing children with severe disabilities. And they are as follows. You are to maximize the child's development in a variety of important developmental areas. And these must include their social communication, their motor skills, their cognitive skills, their pre-academic skills, and self-care, play, as well as personal management. We must also develop the child's social interaction and classroom participation skills. We have to our focus should be placed on teaching the child to follow adult directions while developing their peer relationships. We must also guide them in responding to classroom routines and helping them to become self-directed. That means that they should be able to complete their classroom activities without the constant adult supervision. So in other words, we set a routine schedule in our classrooms for these preschool children. They learn the routine, and then automatically they know what to do. And let me tell you, they are good at picking up on routines. I know that my granddaughter Clara, she just turned 2 last month, and she loves milk, and she knows that I keep milk, and she knows that it's in the refrigerator. And the first thing she does when she walks in my house is she goes to the refrigerator and she says, milk, milk, milk. That's her routine. So she gets a cup of milk as soon as she gets to Pippa's house, and if I have cookies, she can have a cookie with her milk. She doesn't always want the cookie, but she does want the milk. So after she has her milk, then she's ready to get going with whatever else goes on. But that's become her routine pattern. So they learn very early how to function with routine. Increase community participation through support to the family members and any other caregivers that are in that child's life. They struggle. Okay, most of the family, especially when it comes to the parents of preschool age children, these are very young adults, and now they have a child who has multiple disorders, severe disabilities, and they're young at parenthood themselves. Most of the cases, they're young parents themselves. So not only are they learning how to be a new parent, but they're also having to learn how to work with a child with severe disabilities. Now, keep in mind, generally speaking, there are some older parents who have, they've already had other children, and now they've come back in their older age, as we learned earlier in our lecture, that mature age of the mother can cause severe disabilities in their child. So I have seen, and years ago when I had my first child, we became friends with another couple who they had some children that were in their early teens down to about 10 years old, and then later they had a young son named Matthew, who was born with cerebral palsy and severe disabilities there. And so there they were. They had older children. I think they had two older children. I believe it was a 14-year-old and a 10-year-old, and now they have Matthew, who is an infant and severe disabilities. And as Matthew grew through the years, Matthew was the same age as my oldest child. And as Brittany would be toddling around at age 3, 4, 5, 6, Matthew was still lying and being treated as an infant. It was very sad, but I remember this mother, this friend of mine, she was also a classroom teacher. She gave up her job just to stay home and take care of Matthew. So parents are struggling. And if you are a preschool teacher or plan to be a preschool teacher, think about those parents and those families, not just the parents, but the siblings, the grandparents, and anyone else in the family involved in being a caretaker with this child. They need assistance, they need encouragement, and they need support. And as their preschool teacher, you can be a fabulous asset to the support team of this family and these caregivers. Help the family to identify activities within the neighborhood that their preschooler might enjoy participating in. I think I may have shared this with you before in previous chapter lecture videos, but when I was teaching in Fort Smith, when I was teaching 7th, 8th, and 9th grade English, I had a student. I had her in 7th, 8th, and 9th grade English class, and she had cerebral palsy, and she was in a wheelchair. She had the most brilliant brain. In fact, I reconnected with her when I went back to Fort Smith while my mother was in the hospital, and she is now an editor of a magazine. And I ran across that magazine when I was in Fort Smith, and I was like so proud to see that she has gone on. She is living. She's still in a wheelchair, but she had a brilliant mind. And she has gone on to, be an editor of a magazine. And I was so proud to read, when I picked up that magazine and was reading it while I was in the hospital, I was like, oh my goodness, this was my student. I was so proud, of her and her accomplishments. So they can go on to be productive citizens. But I remember in their 9th grade year, that was their last year with me. So I planned a big field trip toward the end of the school year, and there was an indoor ice skating rink in Fayetteville. And so I reserved that skating rink for a couple of hours, and I was taking my 9th graders, and this was our big grand finale. I'm not going to have you next year. You're going into the 10th grade. So let's go do a big celebration of our years together in English class. And she was in a wheelchair. So she went on the field trip, and her mother went along, and she was able to travel from Fort Smith to Fayetteville to go on this field trip. She's in the wheelchair, and she's sitting there watching, and she's happy. I never saw her upset or complaining or anything anyway, but she's sitting there as happy as she can be, and we're all out on the ice skating. And I looked over and I thought, this is really sad. She needs to be on the ice with us. Now, it was just my 9th graders because I had reserved it, so there were not other people there. And I went over and asked her mother, I said, would you care if I pushed her on the ice in her wheelchair? And I said, now, if you oppose, I understand. It's not a problem. And she said, no, she would love that. So, okay. I got her on the ice, and I told her, I said, okay, buckle up, because I don't have a driver's license for a wheelchair on the ice, but we're going to have fun. And all of the students, they lined up, and they were clapping, and they were so excited, and they would skate along with us and talk to her. And she had the best time on the ice. So working with those students, working with those parents, finding activities, those students need to be able to enjoy life as well as we do. And now you see that students and individuals with these, such impairments can now go snow skiing. There are all kinds of things that they can do. So please help with these parents to come up with ideas of ways that they can participate in um, non curricular activities so that they can enjoy a fulfilled life just like everyone else. Also, you want to be sure to prepare the child for inclusive school placements and then provide support for the transition from elementary school into, or from the preschool into the elementary school. Um, this is if you are a preschool worker, a preschool teacher. The preschool is going to be facilitated with educators, um, and they are going to be working collaboratively with the elementary school when it gets time to start that transition. You're going to be working collaboratively with the elementary school, with the family, and incorporating the preschool personnel. Once they do transition over to elementary, the preschool personnel still needs to stay in touch to make sure that transition has gone smoothly. So don't just, okay, here they are. They're going into kindergarten now. They're yours. Don't do that. Continue to work with them back and forth. Let me talk to you about what respite care means. It is the assistance provided by individuals that allows parents and other children within the family some time away from that child with a disability. I think I've already shared with you about our dear friends that had the child with cerebral palsy. Um, they couldn't just, especially the wife, Pam, she just couldn't pick up and take off and go shopping or do other things. But they had family members and they had people in their church that would step in and take care of Matthew while they went to ball games for their children. They even got to go out with us some, and we would go out to dinner. We would get babysitters and go out to dinner, but they didn't get to do this often because they had to be very cautious of who was the caretaker of Matthew when they went out. So it had to be someone acclimated to his condition that could actually care for him. But please keep that in mind and talk to the families and encourage them. It is very important that you get time for yourself away from this child. I have another one of my best friends right now. Her daughter developed some severe disabilities as she was being born as a result of the birthing procedure. And this child, she would have graduated high school last year, technically speaking, and she did get to participate in the graduation, but she cannot function as a normal senior and so forth. But there were times that different family members stepped in and allowed her time away because she's just giving herself all day long around the clock to the care of her young daughter. And it's very important. She has to have her emotional time and her emotional resurgence. So she too is a runner, and so that's something that she and I connect on, and we get to run together some. But she has to have someone, even still today. Her daughter is, she should be a freshman in college this year, but she cannot be left alone. So even for her to get to go out and run her, and train for her marathons and so forth, she has to have someone watching her daughter. So this is very important. So that respite care is extremely important to families who have severe or who have children with severe disabilities. Um, I thought this was a really cool photo that was in our textbook, and I just included it. This is the Culturally Inclusive Preschool Program, and this is focused on um, preschool programs blending the principles and practices that guide special education inclusive education as well as multicultural education. So keep in mind the students from different ethnicities uh, may have multicultural educational needs, and you need to be very aware of that and how you work with those students. The elementary school years, they too must have quality education, and there are such programs for these students with multiple disabilities in the elementary grade levels. Self determination is very important for these students. Uh, these students have preferences and they have needs, and they need to be taken into account when you're developing their educational objectives. And I know that you have heard me say this over and over, and I will never ever say it enough. You must work with each individual child and develop differentiations in your lesson plans so that you do not just have one lesson plan for every single student. You teach the same concepts, the same skills, but you do it on a differentiated level so that you are accommodating the needs as well as the interests of each individual student, whether they have disabilities or not. Every student is different, and you need to meet them at their level of learning as well as their interests. Okay, I can never stress that enough. The school also must value and support parental involvement. Listen, it's not just the teacher, it takes a village. And we've got to have that parental involvement. And that is one of the hardest things for some parents to get involved. Many parents, now you've got some parents, there I did. I had some wonderful parents that if I was having a particular event, or activity going on, I could call on those parents and they were there in a heartbeat, and they would just step up and take charge and help me organize it, um, and be a great parent involved in the education of our classroom activities. You've got those parents that they want the school to be the babysitter, get those kids out of my hair for at least 8 hours, and then I'll deal with them when they get home kind of attitude. And I had a student one year when I taught the fourth grade, one of the years that I taught the fourth grade. This was so sad, but I learned this through the grapevine, and it just broke my heart. This student, he was so precious. How could you not love this child? But when he got off the bus, it did not matter if it was freezing cold outside and there was ice and snow on the ground, or if it was extremely hot in the middle of the summer and it was 110 degrees. It did not matter. When that child got off the bus, that door, they lived in a trailer, that door on that trailer was locked. And those children knew when they got off the bus, they were not allowed to go into the house until it was dinner time, usually about 6 o'clock in the evening. And right after dinner, the kids were told to go to bed. Okay, so by 7 or 8 o'clock, those kids were in bed. So that mother only had like maybe a couple of hours interaction with those children. Uh, she locked them out of the house, and they were not allowed to go in because she did not want to be bothered with them. Now she would let them in so she could feed them dinner because, I mean, after all, she was their mother, so she had to feed them. Um, that is so sad. And so many of our children, you know, their parents don't want to be involved. But if you can become active and creative in coming up with ways that you can involve those parents, please do so, because some of those parents, they would like to be involved, they just don't know how or what to do. So you could be their guide. Now, for those that you can't reach, just step in and have another parent to adopt that child during these activities and so forth, or have a grandparent from the community to come in and adopt that child and be there for that child for these activities. But please try to get these parents involved, because your work with these children in the classroom is only going to be as strong as you can get those parents involved, okay? Instruction focuses must frequently be used as functional skills that are related to that child's everyday life activities. Let me rephrase that to make sure you understand it. Your instructional focus needs to incorporate the everyday life activities that these children are engaged in. And this is again where the differentiation comes in. What are these children's interests? And they may be different from one child to the next in the classroom. So develop your instruction based on their everyday life activities and their everyday interests. The provision of plenty of opportunities for these children to practice the skills. Find ways that they can practice these skills based on things they do on a daily basis and things that they enjoy doing. For example, if it's math and you're trying to teach them a math formula, 2 plus 2 equals 4. Every time you have 2 and 2, you have 4. Teach them if they have to feed animals, because they live on a farm and they feed animals when they get home. You have 2 goats and you have 2 horses. How many feedings are you going to do? For 2 horses, you're going to give them 2, and for 2 goats, you're going to give them 2. How many total is that going to be? 4. Okay, so they can relate it and connect it in that way. So don't just give them the math problem or math formula, but help them to incorporate that into their everyday life activities as well as their interests, okay? Be creative. Differentiate, be creative. Assistive technology and augmentative communication needs to be used when it is available, because it will help maintain or increase the functional capabilities of the student who has severe and multiple disabilities. I had a student, this is when I taught the senior high English, and I did 10th, 11th, and 12th grade. Yes, I did the advanced placement, and this student had, he was deaf. And he later, by the time he was a junior, he was able to have the cochlear ear implant done and have the cochlear hearing aids implanted in his ears, which helped. But of course, because he had a hearing disability, he was deaf, he had speech impairment. So you had to listen very carefully when he spoke to you to understand what he was saying. But this parent wanted her child in my advanced class because she knew that I wouldn't baby him, that I would give him high level. And she wanted to push him, and he did go on to college and get a degree, but she wanted him in that class. But I had to wear a device that would record my lectures, and it would be published on the screen, and the writing would come up on the screen as I was talking. And I also learned, that was in the early stages when all of these devices were I believe our device that we used was Dragon, and there were problems that sometimes it wouldn't say exactly what I said on the screen. It would come up with words that I would never, ever include in my vocabulary, if you know what I mean. And sometimes it would come up with phrases that would be, oh my goodness, that's, an off-the-wall phrase that is not appropriate for this classroom setting. So I learned early on to type out all of my lecture notes, everything that I would say in a lecture, and I would post those on the screen, and I would follow that as I went along. Now, I did have someone, the students were taking notes, and so if some things came up that weren't said, then we would make a copy of those notes. And I sent those lecture notes to his mother at the beginning of the week, every week, so that she could review those with him in the evenings at home. And that was one of the accommodations that I came up with to help accommodate her child. So those differentiations and those accommodations are very important, but definitely using those assistive technologies. I had another student, I've got lots of stories and I'll try not to bore you with too many, but I had another student who was extremely dysgraphic, and he had other severe disabilities, but he was mainstreamed into the English. And this is when I taught the regular 10th grade English class. And this student had to type everything, but with all of his complicated severe disabilities, his grammar was never that of his age level and his grade level. So I had to make accommodations in how I graded his work. I had to go to the root of what he was trying to convey in his essays. His handwriting looked more like squiggles and worms wiggling across the page as opposed to actual letters. So he had to use a computer. And we went so far with him as getting the device that he could speak to it and it would type it out for him. So using those assistive technology tools, be prepared for doing that and be willing. You're going to have, you may have to work a little extra hard with your students, but be willing to go the extra mile if it means that child is going to get the very best education and the best opportunity for learning experience as possible, because that child is so valuable and so important. Okay, parental involvement, majorly important. Teaching functional skills, majorly important. Using the assistive technology and the augmentative communication, I have already covered that in my previous slide. There are aids for daily living, such as the non-slip placement to hold a bowl in place. Some of your students are going to have problems with using their hands. Some of these students are going to be carrying with them computers that output their voice. They're going to be wearing those hearing aids, may have those cochlear implants. They're going to be using aids for learning and playing. They may wear braces on their legs. They may even have artificial limbs or prosthetic hands. They may have mobility aids, wheelchairs, lifts, walkers. Yes, and I've seen students, they're able to walk, but they do have those walkers, and they push those around from class to class and location to location within the building. They may need those positioning aids, such as cushions, the pelvic strips, or hip guides. They may even, and I have seen these, students have to wear those head supports in their, on their wheelchair because they don't have the neck muscles to control their heads. Augmentative communication. These are communication systems that involve adapting existing vocal or gestural abilities into meaningful communication, or using manual or electronic devices. Using audio textbooks and audiobooks are great tools that you can have available for these students as well. PECS. This is a symbol-based communication system that was developed in 1985 as a unique augmentative alternative communication method for people with developmental disabilities. Here's a photo that our book displayed of one of these type devices. This is the computerized touch screen with a language board. The adolescent years. Crockett and Hardman in 2009 addressed 4 tips for planning the transition from adolescent, high school years to adult life. This is a very important thing. We've got to be able to help these students transition into society and to be able to function and live their adult life. We need to help them establish a network of friends and acquaintances that can understand their underlying problem and help guide them on a regular basis. We need to help them develop the ability to use their community resources on a regular basis. There are community resources available to adults with disabilities, and we need to help them. We need to transition them maybe the last 9 weeks, maybe perhaps probably more than likely throughout the course of their whole senior year that they are with us in the school setting, guiding them to those community resources and how to use them consistently and regularly. Help them secure a paid job that is going to support the use of the community resources and the interaction with their peers. And you can see some of the pictures that I've posted below. The last one is to establish independence, helping them to establish independence and an autonomy in making life choices. Okay, so yes, just because they have a disability does not mean they cannot be married and live a successful life. The student that I told you about, that I took her ice skating in her wheelchair, she was able years later, she's married, and she, has a wonderful, productive life now. She will never be able to live outside of her wheelchair and be able to function outside of her wheelchair, but she can live a productive life. As I told you, she's the editor of a big magazine now. This is a person utilizing from the wheelchair the community resources at the community center. And then this is a young man who actually has a job and is functioning in society. And we're so proud when we see them move on into society and be able to function. So it is up to you as their high school teacher to help them prepare for this transition into adulthood. The inclusive education involves the physical placement of students with severe and multiple disabilities into the general education classrooms settings. These classes, these are the classes that the students attend that do not have disabilities, but we migrate these students into certain classes to give them inclusive education experiences. Inclusive education also involves the high level expectations and supports that allows these students to be able to access the grade level standards that their peers in that grade level are having access to. They should be able to participate in the alternative assessments to monitor their growth and achievement. We should document, I would document on a weekly basis, their growth, what they did last week compared to what they're doing this week, and keep up with their growth and their achievement accomplishments. Systematic organization of opportunities for interaction between students with severe and multiple disabilities along with students who do not have those disabilities. So in other words, you're preparing and providing opportunities for interaction between these two different groups of students. Specific instruction in valued post-school outcomes that will increase the competence of these students in the natural settings of family, school, and community. Okay, now what that means is you are providing them with post-school outcomes. You're setting some outcomes. By the time they complete their education in this high school, they will have achieved these outcomes, which will enable them to function post-school, after school, after they graduate. They will be able to function in society, in their community, and in their family settings. And even in college settings, we do disjustice to students. We do disservice to them if we do not prepare them for the college scene, because many of them have the capabilities of moving on to college. And it's up to the high school teachers to get them ready too, along with the other students, get them ready to move into the college world. Carefully read back over pages 306 through 308 in your textbook to learn the tips for helping the families, to learn tips that teachers and school personnel can do to help students with severe and multiple disabilities, and to get tips for you as their teachers to help their families and their neighbors learn how to work with them. So please review those pages carefully. This is the conclusion of my lecture over Chapter 12, dealing with severe and multiple disabilities. I want to wish you the best as you continue to delve into this information and glean everything you can, and take this information with you as you go into the classroom as a teacher. Have a wonderful week and weekend, and take care and stay safe.